Welcome to our medical assistant practice test. This test consists of 100 questions designed to help you prepare for your medical assistant certification exam. Each question includes an explanation of the correct answer, so you can understand the reasoning behind it. Whether you're just starting out in your medical assistant career or you're looking to refresh your knowledge, this practice test is a great way to get a feel for the types of questions you can expect on the actual exam. Let's get started. 1. Medicare Part A. A. Covers inpatient care. B. Covers outpatient care. C. Is voluntary and pays 80% by Medicare and 20% by the patient. D. Allows participants to choose managed care plans. Correct answer: covers inpatient care. Medicare Part A covers inpatient hospital stays. Part B covers outpatient coverage. Part C, also known as Medicare Advantage, is another Medicare plan that covers Part A and B. Part D covers pharmaceuticals. 2. When reading the CPT manual, a triangle next to a code notes A. A new procedure. B. Revised code description. C. Add-on codes. D. Codes that are not to be used with modifier -51. Correct answer: B. Revised code description. Symbols added to CPT codes give the codes additional information. A triangle will denote that a code has been recently revised. 3. When considering coding for hospital stays, A_ is used to provide physicians with guidelines for admission and length of hospital stays. A. Diagnosis-related group, DRG. B. Healthcare Financing Administration Common Procedural Coding System, HCPCS. C. Relative Value Study, RVS. D, E, and V codes. Correct answer: A. Diagnosis-related group, DRG. Diagnosis-related groups are used for inpatient hospital stays. These codes help physicians decide the length of stay for a patient with a particular type of illness or condition. Most medical assistants will not directly deal with DRGs as MAs are not usually found in hospital settings. 4. Where would your office obtain additional legal copies of Medicare forms? A. From an agency listed in the Medicare Fiscal Agencies Directory. B. Internal Revenue Service. C. Centers for Disease Control. D. A local campus office. Correct answer: from an agency listed in the Medicare Fiscal Agencies Directory. Medicare forms can be found by searching the Internet for a Medicare fiscal agency in your geographic location. The IRS, CDC, and campus offices would not have this type of information. 5. Which of the following is not considered an asset? A. Money. B. Bank debts. C. Medical and office equipment. D. Land, buildings, furniture. Correct answer: B. Bank debts. Bank debts are considered a liability. Assets are property owned and controlled by a business, including land, building, equipment, money, stocks, bonds, and investments. 6. A physician asks a medical assistant to run to the store to get stickers to give to children who come into the office for medical care. How should the medical assistant pay for the stickers? A. Accounts receivable. B. Petty cash. C. Accounts payable. D. Personal check. Correct answer: B. Petty cash. Petty cash is the cash kept within the office to cover for minor purchases. This eliminates the need to write a check for minor purposes. 7. A doctor's office recently bought new waiting room furniture and financed the purchase. From the perspective of the doctor's office, what is the nature of the debt owed to the vendor? A. Asset. B. Account receivable. C. Account payable. D. Owner's equity. Correct answer: C. Account payable. An account payable is money owed to a vendor. These can be for purchases for goods or services. 8. IRS Form W-2 refers to A. Request for federal tax identification number. B. Social Security number application form. C. Wages and tax statement. D. Federal unemployment tax return. Correct answer: C. Wages and tax statement. A W-2 tax form shows the amount of taxes withheld from your paycheck for the year. It is used to file for federal and state taxes. 9. The government agency that regulates Medicaid and Medicare. A. HCFA. B. CPT-CICD. D. OSHA. Correct answer: A. HCFA. The Healthcare Financing Administration, HCFA, is the government agency that regulates Medicaid and Medicare. HCFA establishes standards for medical providers that require compliance to meet certification requirements. 10. What coding system is used to code for procedures and medical services provided by the practitioner? A. ICD-10. B. HCPCS. C. CPT-D. FDA. Correct answer: C. CPT. Current. Procedural terminology, CPT, is a list of codes of procedures and services performed by health practitioners. The CPT book is divided into 6 sections: E&M, anesthesia, surgery, radiology, pathology, and medicine. 11. A patient was brought to the emergency room because of slurring of speech and weakness of the right arm. 6 hours after, the patient feels normal. What is the condition of this patient? A. Stroke. B. TIA. C. Myocardial infarction. D. Subarachnoid hemorrhage. Correct answer: B. T. A transient ischemic attack, TIA, is when blood flow to a part of the brain stops for a brief period of time. A person will have stroke-like symptoms for up to 24 hours. 12. A patient presents with a rapid and weak pulse, shallow breathing, hypotension, and cold and clammy skin from a gunshot wound. What is the condition of this patient? A. Hemorrhage. B. Shock. C. Stroke. D. Heart attack. Correct answer: B. Shock. The patient's presentation is hypovolemic shock due to massive blood loss. The patient presents with rapid and weak pulse, shallow breathing, hypotension, and cold and clammy skin. 13. A 55-year-old male patient presents with symptoms of diaphoresis and chest pain for more than 30 minutes, not relieved by analgesics. What condition should be suspected in this patient? A. Pneumonia. B. Stroke. C. Myocardial infarction. D. Pneumothorax. Correct answer: C. Myocardial infarction. Patients that are middle-aged and having chest pains suggesting of heart in origin, the next best step is to do an ECG and rule out myocardial infarction or heart attack. Other causes of chest pain should also be ruled out. 14. The doctor ordered the medical assistant to apply rice to the patient with a sprain. Which of the following is not a rice application? A. Rest the injured part. B. Put ice on the affected areas. C. Conditioning. D. Elevate the affected area. Correct answer: C. Conditioning. A sprain is a stretch or a tear of a ligament. Application of rice is appropriate for sprains. Rice refers to rest, ice, compress, and elevate. From the choices, conditioning is not part of rice. 15. A patient was brought to the clinic because of a burn on the right hand. The site has blistered red appearance with edema. What is the classification of the patient's burn? A. Superficial. B. Partial thickness. C. Full thickness. D. Third degree. Correct answer: B. Partial thickness. Second degree burns or partial thickness burns are painful and develop blisters. The site should be immersed in cool water and a sterile dressing applied. 16. A 65-year-old female was brought to the emergency room because of high fever, hypotension, tachypnea, and cold, clammy skin. The patient has severe pneumonia. What type of shock does the patient have? A. Septic shock. B. Neurogenic shock. C. Cardiogenic shock. D. Anaphylactic shock. Correct answer: septic shock. The patient has a life-threatening condition called septic shock caused by an overwhelming infection. Shock is caused by decrease in oxygen and leads to low blood pressure, weak pulse, increased respiratory rate, cold, clammy skin, and anxiety. 17. A 28-year-old man cut himself with a knife while slicing a rack of ribs. To control the patient's hemorrhage, the initial step is to A. Apply a tourniquet below the site. B. Immobilize the part. C. Apply direct pressure. D. Give topical antibiotic. Correct answer: C. Apply direct pressure. The initial step in a bleeding patient is to prevent the patient from bleeding further by applying direct pressure on the site. Applying a tourniquet below the site will not stop the bleeding. The part should be elevated. 18. Why is the review of systems important for the health practitioner? A. To know the reason why the patient visited the doctor. B. To uncover other health issues of the patient that were not mentioned in the other parts of the history. C. To screen cancer and genetic problems. D. To address the lifestyle of the patient. Correct answer: B. To uncover other health issues of the patient that were not mentioned in the other parts of the history. The review of systems is a list of signs/symptoms organized by organ systems designed to uncover underlying conditions and diseases. To address the patient as a whole, the doctor has to uncover all health issues. 19. When the patient complains of abdominal pain, how will you know what organ is most likely affected? A. Divide the abdomen into 4 sections, and ask the patient in which section the pain is. B. Ask the patient how severe the pain is. C. Ask the patient when did the pain start. D. Divide the abdomen into upper and lower quadrant and ask if the pain is upper or lower. Correct answer: divide the abdomen into 4 sections, and ask the patient in which section the pain is. To locate which organ is most likely affected by the patient's symptoms, divide the abdomen into 4 sections and ask the patient to identify the location of the pain. Although it is not that accurate, it is a good way of localizing which organ can possibly be included in the differential diagnosis. 20. A patient, a 17-year-old female, is complaining of palpitation and fast heartbeat. The patient has a history of panic attacks and anxiety. To determine if she has tachycardia, the medical assistant decided to use her thumb to count the pulse. Is this recommended to determine pulse? A. No. The thumb has its own pulse. B. No. The skin of the thumb is too sensitive. C. No. The skin of the thumb is not sensitive enough. D. Yes, it is recommended to use the thumb to take a pulse. Correct answer: no. The thumb has its own pulse. The thumb has its own pulse called the thenar pulse. The pulse of the thumb can interfere with the counting of the pulse, thus it is not recommended to use. 21. The following are included in the rules on charting, except check carefully the name on the chart. B. Chart in pencil. C. Do not chart assumptions. D. Date each entry and sign with your complete name and title. Correct answer: B. Chart in pencil. When documenting the medical history of the patient, a non-erasable ink should be used. Erasable ink or pencils are not recommended for documenting legal documents such as the medical chart. 22. A sphygmomanometer is used to A. Check for heart disease. B. Check blood pressure. C. Check for pulse. D. Check for vital signs. Correct answer: B. Check blood pressure. A sphygmomanometer is an instrument for measuring arterial blood pressure. There are 3 types of sphygmomanometer: aneroid, electronic, and manual. 23. What term is used when all microorganisms including the spores in an instrument have been eliminated? A. Sterile. B. Asepsis. C. Sanitized. D. Disinfected. Correct answer: sterile. Sterilization is the killing or removal of all microorganisms, including bacterial spores. Sterilization can be achieved through dry heat, steam, radiation, or chemical methods. 24. What is the position that produces the most accurate blood pressure determination? A. Have the patient in a sitting position with an arm extended at heart level. B. Have the patient in a standing position and arm curled up. C. Have the patient lying down with palms in a down position. D. Have the patient sitting with an arm extended above the heart. Correct answer: A. Have the patient in a sitting position with an arm extended at heart level. The proper position to take the blood pressure is to place a patient in a sitting position with an arm extended at heart level. Research has shown that position can affect the patient's blood pressure readings, therefore, proper patient positioning is important to have an accurate blood pressure determination. 25. Red-marked glass thermometers are used to take what temperature? A. Axillary. B. Rectal. C. Tympanic membrane. D. Oral. Correct answer: B. Rectal. Red-tip thermometers are rectal thermometers. Blue-tip thermometers are used orally or axillary. 26. A medical assistant cleaned a patient's wound using forceps. She then soaked the forceps in alcohol. Which aseptic technique did she use? A. Sterilization. B. Autoclaving. C. Sanitization. D. Disinfection. Correct answer: D. Disinfection. The process of eliminating pathogenic microorganisms using chemicals is disinfection. Disinfectants are chemicals that are used on inanimate objects to either eliminate microorganisms or to make them inactive. 27. A physician is about to give a pap smear procedure to a patient. As a medical assistant, you assist the patient and help her get into position for the procedure. What position should you put her in? A. Horizontal recumbent. B. Lateral Sims. C. Fowlers. D. Lithotomy. Correct answer: D. Lithotomy. In a pap smear, the patient should be placed in the lithotomy position. In lithotomy, the patient is on her back with the hips and knees flexed and the thighs apart. The position is often used for vaginal examinations and childbirth. 28. A wound where tissue is not just separated but torn away from the body is referred to as A. Laceration. B. Avulsion. C. Abrasion. D. Gangrene. Correct answer: B. Avulsion. An avulsion is a type of wound where the tissue is not just separated but torn away from the body, forming a flap. Avulsion wounds may take longer to heal because they cannot be closed with tape or stitches. 29. Michael, a 5-year-old boy, has been complaining of itchiness, rash, and irritation around the anal area. He was brought to the clinic by his mother, and to her surprise, the doctor performed a Scotch tape test. This test is used to diagnose infestation of which parasite? A. Mosquitoes. B. Fungus. C. Roundworms. D. Pinworms. Correct answer: D. Pinworms. A Scotch tape test is the simplest and effective way of detecting pinworm infestation. The tape is viewed under the microscope, and if D-shaped eggs are seen, a diagnosis of pinworm infestation is made. 30. Round-shaped bacteria that are seen in pairs are called A. Streptococcus. B. Diplococcus. C. Staphylococcus. D. Bacillus. Correct answer: B. Diplococcus. Diplococci are bacteria that are seen in the microscope as pairs of round-looking organisms. Neisseria gonorrhea is a bacteria that is classified as an STD and is an example of a diplococcus. 31. When placing a patient on the weighing scale, the medical assistant should a. Ask the patient to remove all clothing. B. Ask the patient to face away from the scale. C. Make sure that the scale is calibrated and balanced before actually weighing the patient. D. All of the above. Correct answer: C. Make sure that the scale is calibrated and balanced before actually weighing the patient. Before weighing the patient, the medical assistant should check first if the weighing scale is calibrated and balanced to prevent false readings. The rest of the choices are not required in weighing the patient. 32. Dr. Jones closed his medical practice and moved to another state while he had patients under his care. He failed to inform his patients that he was terminating their treatment. What cause of action may be brought against Dr. Jones by his patients? A. Breach of contract. B. Non-compliance. C. Defamation. D. Abandonment. Correct answer: D. Abandonment. To properly terminate the contract between the physician and the patient, the physician must notify the patient in writing in advance if the patient still needs treatment. Failure to do so results in abandonment. 33. Registered Medical Assistant (RMA) credential is awarded by which certification agency? A. AMT. B. AMA. C. MA. D. NA. Correct answer: A. AMT. Founded in 1939, American Medical Technologists (AMT) is a nationally recognized certification agency and membership society for medical assistants. AMT is accredited by the National Commission for Certifying Agencies, NCCA. The Registered Medical Assistant (RMA) credential is awarded by the AMT 34. The acronym AMA refers to A. Association of American Medical Assistants. B. American Association of Medical Assistants. C. American Alliance for Medical Assistants. D. American Administration for Medical Assistants. Correct answer: B. American Association of Medical Assistants. AMA refers to American Association of Medical Assistants. The mission of the American Association of Medical Assistants is to provide the medical assistant profession with education, certification, credential acknowledgement, networking opportunities, scope of practice protection, and advocacy for quality patient-centered health care. 35. If a medical assistant defies the doctor and refuses to obey his orders, it is an act of A. Prejudice. B. Sarcasm. C. Insubordination. D. Tenacity. Correct answer: C. Insubordination. Failure to obey orders and defiance of authority is insubordination. Refusing to obey an order that is unethical or illegal is not considered insubordination. 36. Putting off pending tasks to a later time, sometimes completing the task right before the deadline, is A. Proactive. B. Indolent. C. Procrastinate. D. Negligent. Correct answer: C. Procrastinate. Procrastination is the practice of putting off tasks at a later time, sometimes to the right before the deadline. Carrying out less important tasks because they are more pleasurable to do often leads to procrastination. 37. Which of the following is an example of professional conduct? A. Coming in a little late, but going home at a later time. B. Assisting fellow workers and expecting praise. C. Saying no to office politics and gossiping. D. Getting information about fellow employees and telling the supervisor about the information. Correct answer: C. Saying no to office politics and gossiping. Avoiding office politics and gossiping is an example of professional conduct. Office politics is the use of social networking within an organization to achieve changes that benefit the individuals within it. 38. Two patients arrive at the office simultaneously, one with severe high blood pressure and the other one with a severe headache. Deciding which patient is to be seen by the doctor first is referred to as screening. B. Deprioritizing. C. Triage. D. Selecting. Correct answer, C. Triage. Triage is the process of prioritizing sick or injured people for treatment according to the seriousness of the condition. Prioritizing patients ensures that patients are treated efficiently, especially when resources are not enough for all to be treated immediately. 39. Which of the following locations offers the most protection to confidential communications? F. Waiting room. B. Reception area. C. Examination room. D. Cafeteria. Correct answer, C. Examination room. Confidentiality is one of the core duties in the practice of medicine. It requires healthcare providers to keep health information private unless there is consent to release the information. Discussing patient information is not recommended in public places such as waiting rooms, reception areas, and cafeterias. The examination area is a recommended area to discuss patient information. 40. A filing system that consists of a series of 43 file folders including 12 monthly and 31 daily folders. A. Tickler file. B. Color coding file. C. Subject file. D. Alphanumerical file. Correct answer, A. Tickler file. A tickler file is a system that organizes chronologically for follow-up. It is a system intended to act as an addition to calendaring and scheduling systems. 41. All of the following are rules to be followed when charting, except chart in black ink. B. Use of correction fluid. C. Write in legible handwriting. D. If it was not charted, it was not done. Correct answer, B. Use of correction fluid. Corrections are done by the following steps: draw a single line on the error, write the initials of the person correcting the error, write the date when the correction was made, and write the correct information. Corrections should never be covered by correction fluid. 42. Which of the following is not one of the C's of charting? A. Check. B. Current. C. Complete. D. Concise. Correct answer, check. The 6 C's of charting are current, complete, concise, correct, confidential, and clean. Check is not one of the 6 C's of charting. 43. All of the following should be followed when purging medical records, except medical records can be destroyed by shredding or burning. B. Facility should maintain a master list of all records. C. Medicare records should be maintained for 10 years. D. Medicaid records should be maintained for 5 years. Correct answer, D. Medicaid records should be maintained for 5 years. Medicare and Medicaid records should be maintained for 10 years. Medical records should be destroyed by shredding, and the facility should have a master list of all records. 44. The root word lapar/o means chest. B. Skull. C. Abdomen. D. Neck. Correct answer, C. Abdomen. Lapar/o is the root word of abdomen. The root word for chest is thorax/o, skull is crani/o, and neck is cervix/o. 45. The transverse plane of the body is also known as the underscore. A. Frontal plane. B. Cross-sectional plane. C. Coronal plane. D. Sagittal plane. Correct answer, B. Cross-sectional plane. The cross-sectional plane is also referred to as transverse plane. The frontal plane is referred to as the coronal plane and the sagittal plane is referred to as the lateral plane. 46. Which of the following is the suffix for to create an opening? A. Ectomy. B. Tomy. C. Stomy. D. Logie. Correct answer, C. Stomy. The suffix stomy means to create an opening. The suffix ectomy means excision or to remove, tomy means to cut, and logi means study of. 47. An abnormal curvature of the spine is a disease called spina bifida. B. Scoliosis. C. Osteomyelitis. D. Osteomalacia. Correct answer, B. Scoliosis. Scoliosis is a lateral curvature of the spine. Spina bifida is a birth defect that involves the incomplete development of the spinal cord or its covering. Osteomyelitis is infection of the bone and osteomalacia is deficiency of calcium. 48. What prefix means below? A. Infra dash. B. Anti dash. C. Contra dash. D. Retro dash. Correct answer, A. Infra dash. Infra is the prefix that refers to below or under. Ante refers to before, contra refers to opposite, and retro refers to behind. 49. The valves on the right side of the heart are tricuspid and mitral valves. B. Pulmonic and aortic valves. C. Tricuspid and pulmonic valves. D. Mitral and aortic valves. Correct answer, C. Tricuspid and pulmonic valves. The valves on the right side of the heart are tricuspid and pulmonic valves. The valves on the left side of the heart are mitral and aortic valves. 50. The medical term for reduced blood flow is A. Infarction. B. Embolus. C. Ischemia. D. Thrombosis. Correct answer, C. Ischemia. Ischemia came from the root word ish/o and suffix emia. Ish/o means reduced flow and emia means blood condition. Ischemia is a reduction of blood flow to the tissues. 51. The lifting of the shoulders and turning of the head is controlled by cranial nerve 12. B. Cranial nerve 11. C. Cranial nerve 10. D. Cranial nerve 9. Correct answer, B. Cranial nerve 11. Cranial nerve 11 is referred to as the spinal accessory nerve which supplies information about spinal cord, trapezius and other surrounding muscles. It also provides muscle movement of the shoulders and surrounding neck. 52. What is the term for slow breathing? A. Bradycardia. B. Bradyarrhythmia. C. Bradypnea. D. Bradykinesia. Correct answer, C. Bradypnea. Bradypnea is the term for slow breathing. Brady refers to slow and knee refers to breathing. 53. The following are true statements of the urinary bladder, except A. It serves as a temporary reservoir of urine. B. It is located in the abdominal cavity. C. It is muscular so it can expel the urine. D. It is hollow so it can expand when it is filled. Correct answer, B. It is located in the abdominal cavity. The urinary bladder is located in the pelvic cavity, not in the abdominal cavity. It serves as a reservoir of urine. It is also muscular and hollow so it can expand and expel urine. 54. What is the procedure to detect cancer in the large intestines? A. Cholecystectomy. B. Laparoscopy. C. Angioplasty. D. Colonoscopy. Correct answer, D. Colonoscopy. Colonoscopy is the procedure to detect cancer in the large intestine. Colon refers to the large intestine and scopy refers to visually examine. 55. What is the recommended pulse site that the medical professionals use when doing a routine check of the pulse rate? A. Radial artery. B. Carotid artery. C. Femoral artery. D. Brachial artery. Correct answer, A. Radial artery. The radial artery is the most common pulse site to determine the patient's pulse rate. The carotid artery is used for CPR. The brachial artery is used for blood pressure determination and femoral artery is used to check lower limb circulation. 56. A 45-year-old was brought to the hospital because of vomiting of blood. The term for this is A. Hemoptysis, B. Epistaxis, C. Hyperemesis, D. Hematemesis. Correct answer, D. Hematemesis. Hematemesis is the term for vomiting of blood. The suffix emesis refers to vomiting, and the root word hemat/o refers to blood. 57. Which of the following is not used to clean the site for a blood culture specimen? A. Iodine, B. Surgical soap, C. Lysol, D. Alcohol. Correct answer, C. Lysol. Lysol is not used to clean sites for blood culture. Lysol is a disinfectant that is used for inanimate objects and not on living tissues. 58. Which of the following blood samples should be placed in ice water? A. Lead testing, B. Glucose tolerance test, C. Arterial blood gases, ABG, D. Blood culture. Correct answer, C. Arterial blood gases, ABG. If the ABG sample is not analyzed immediately, a false reading can result due to blood cell metabolism. Using ice slows metabolism, allowing the blood sample to stay viable for a longer time period, possibly up to 30 minutes. 59. The normal bleeding time is A. 2 to 8 minutes, B. 10 to 15 minutes, C. 20 minutes, D. 1 hour. Correct answer, A. 2 to 8 minutes. Normal bleeding time is 2 to 8 minutes. Bleeding time is a test used to determine how quickly your blood clots to stop you from bleeding. The test involves making small, superficial cuts on the skin. 60. A finger stick is done on the following fingers: A. Middle and index finger, B. The thumb and the middle finger, C. Small and ring finger, D. Middle and ring finger. Correct answer, D. Middle and ring finger. The finger is usually the preferred site for capillary testing in an adult patient. The sides of the heel are only used in pediatric and neonatal patients. The middle or the ring fingers are the recommended sites for capillary puncture. 61. What is the number one complication of venipuncture? A. Seizure, B. Hematoma, C. Fainting, D. Petechiae. Correct answer, B. Hematoma. The number one complication of venipuncture is hematoma. When blood leaks to the surrounding tissues because of inadequate hemostasis, hematoma can occur. 62. A patient came in complaining of having a burning sensation while urinating. What chemical in the urine would confirm a suspicion that the patient has a urinary tract infection? A. Ketone, B. Bilirubin, C. Blood, D. Nitrite. Correct answer, D. Nitrite. Nitrite and leukocyte esterase are chemicals in the urine that indicate a UTI. Most bacteria that colonize in the urinary tract cause nitrates to be converted to nitrites. 63. Surgical hand washing is performed in this way: by scrubbing for 4 minutes, B. For 10 minutes using a sterile hand brush, C. For 15 minutes with germicidal soap, D. For a full 20 minutes. Correct answer, B. For 10 minutes using a sterile hand brush. For a surgical hand washing, often called a surgical scrub, it is very important to remove dirt and microorganism from the surface of the skin. Included in materials needed would be surgical soap, orange sticks, sterile towels, and a sterile surgical scrub brush. The total hand washing should be approximately 10 minutes. 64. The transplant of animal tissue into a human: A. Isograft, B. Heterograft, C. Homograft, D. Autograft. Correct answer, B. Heterograft. Heterograft can also be called a xenograft, and it is the transplant of animal tissue into a human. An example of this would be using the heart valve from an animal into the heart of a human being. An isograft is a transplantation from a genetically identical twin. Homograft, also called allograft, is a tissue transplant between two humans, not identical twins. An autograft is a transplantation of a person's own tissue from one part of the body to another. 65. When should the meningococcal vaccine be administered? A. Age 11. B. At birth. C. Age 21. D. Age 40. Correct answer, A. Age 11. Meningococcal vaccine is routinely indicated at age 11. The vaccine is also indicated for adults with the following conditions: asplenia, complement deficiency, dormitory residence, and military. 66. The greeting used in a letter such as, "to whom it may concern," is what part of a letter? A. Complimentary closing. B. Salutation. C. Signature. D. Attention line. Correct answer, B. Salutation. To whom it may concern is a salutation. A salutation is a greeting used in written communications. Salutations can be formal or informal. The salutation "dear" is the most widely used salutation. 67. An electronic device that makes possible the transmission of data to and from a computer via telephone or other communication lines. A. Hard drive. B. RAM. C. URL. D. Modem. Correct answer, D. Modem. The word modem is actually short for modulator/demodulator. It allows the connection of one computer to another, and the transfer of data over telephone lines. 68. All of the following are input devices for a computer, except mouse. B. Keyboard. C. Printer. D. Random access memory. Correct answer, D. Random access memory. Random access memory, RAM, is the working memory of the computer. It is not considered an input or external device. 69. Which of the following is not a storage device? A. Memory stick. B. Zip drive. C. Router. D. DVD. Correct answer, C. Router. A router is not a storage device. It is a networking device that forwards data between computer networks. 70. What reference is used at the end of a letter to list people who will receive a copy of the letter? A. Enc. B. DH, C. CCD, yours truly. Correct answer, C. CC. A copy notation is a notation so that the addressee knows that a copy of the letter will be sent to other people. A copy notation is abbreviated as CC, followed by the names of the people who will receive the letter. 71. Which of the following devices allow the user to manipulate the cursor? A. Tab key. B. Backspace. C. Bluetooth. D. Mouse. Correct answer, D. Mouse. The mouse is a pointing device to manipulate the cursor. It also allows the user to interact with the items on the display screen. 72. Which mail classification includes cards, letters, and parcels that weigh 13 ounces or less? A. Priority mail. B. Standard mail. C. First-class mail. D. Periodicals mail. Correct answer, C. First-class mail. First-class mail includes cards, letters, and parcels that weigh 13 ounces or less. It also includes handwritten or typewritten material, bills, statements of account or invoices, credit cards, personal correspondence, and all matters sealed or otherwise closed against inspection. 73. 1 gigabyte is approximately how many bytes? A. 1024 bytes. B. 1 million bytes. C. 1 billion bytes. D. 1 trillion bytes. Correct answer, C. 1 billion bytes. 1 gigabyte is approximately 1 billion bytes. 1 kilobyte is 1024 bytes, 1 megabyte is 1 million bytes, and 1 terabyte is 1 trillion bytes. 74. In a business letter, what margin is commonly used? A. Half an inch. B. 1 inch. C. 2 inches. D. 3 inches. Correct answer, B. 1 inch. The commonly used margin in a business letter is 1 inch to 1¼ inches on all sides. This is also the default setting of most word processors. 75. The substance in the body that is needed for energy: A. Protein. B. Fat. C. Carbohydrate. D. Minerals. Correct answer, C. Carbohydrate. Glucose is the main fuel of the body. Glucose makes up carbohydrates. Carbohydrates are the most important source of energy for our body. 76. If the patient's BMI is 27, what would be the classification of the patient? A. Overweight. B. Underweight. C. Normal weight. D. Obese. Correct answer, A. Overweight. Body mass index, BMI, is a measure of body fat based on height and weight. A BMI of 25 to 29.9 is considered overweight. BMI over 30 is considered obese. A BMI of 18.5 to 24.5 is considered normal weight, and BMI below 18.5 is considered underweight. 77. What vitamin deficiency will lead to night blindness? A. Vitamin B1. B. Vitamin A. C. Vitamin D. D. Vitamin C. Correct answer, B. Vitamin A. Deficiency of the fat-soluble vitamin A will lead to night blindness. Night blindness or nyctalopia is a type of vision impairment. People with night blindness experience poor vision at night or in dimly lit environments. 78. Osteomalacia is caused by a deficiency of vitamin B1. B. Vitamin A. C. Vitamin D. D. Vitamin C. Correct answer, C. Vitamin D. Vitamin D is important for maintaining bone density and strength. Vitamin D deficiency results in osteomalacia or softening of the bones. 79. Mrs. Nagel is 6 weeks pregnant. She has a family history of congenital birth defects. She is concerned about neurological diseases during pregnancy. Which vitamin is used in pregnancy to prevent her baby from having spina bifida? A. Folic acid. B. Iron. C. Ascorbic acid. D. Magnesium. Correct answer, folic acid. Folic acid deficiency increases the possibility of a neural tube defect, such as spina bifida or anencephaly. All women of childbearing age should consume 400 micrograms of folic acid a day. 80. A 42-year-old male came to the clinic complaining of twitching of the muscles. Sometimes the patient involuntarily jerks for no reason. He said he started experiencing the twitches after he started water therapy and started to urinate frequently. Which mineral most likely is the culprit for his twitching? A. Manganese. B. Magnesium. C. Copper. D. Zinc. Correct answer, B. Magnesium. Magnesium is a mineral that is present in large amounts in the body. Magnesium is needed for calcium regulation. Deficiency of magnesium can result in low calcium in the blood or hypocalcemia. Hypocalcemia can result in numbness, muscle spasms, and twitching. 81. A physician's prescription ordered 120 mg per day of medication for a patient. The patient is to take 1/2 the dose in the morning and 1/2 in the evening. The medication comes only in 30 mg tablets. How many tablets will the patient take combined in one day? A. 6. B. 8. C. 4. D. 2. Correct answer, C. 4. The patient will take 2 tablets, totaling 60 mg in the morning and 2 tablets, totaling 60 mg in the evening. That will be a combined total of 4 tablets in one day. 82. Used therapeutically, certain medications reduce anxiety in certain stress disorders, relieve insomnia and aid in pain relief. Which of these would not? A. Depressants. B. Barbiturates. C. Tranquilizers. D. Hallucinogens. Correct answer, D. Hallucinogens. Hallucinogens excite the central nervous system. Depressants, barbiturates and tranquilizers depress the central nervous system and can be used for brief periods of time under the care of a physician. 83. Medication, when applied to a patch that is affixed to the patient's skin, is called A. Buccal. B. Transdermal. C. Topical ointment. D. Mantoux test. Correct answer, B. Transdermal. Transdermal drug delivery is a method of applying a drug to unbroken skin. Absorption is continuous and enters the bloodstream through the skin. Transdermal patches are applied to a clean, dry, and hairless area of the skin. 84. What is another name for a pre-filled syringe? A. Flange. B. Insulin syringe. C. Tuberculin syringe. D. Cartridge. Correct answer, D. Cartridge. A cartridge, or pre-filled, syringe, is a sterile disposable syringe. The needle units are manufacturer packaged and contain a single dose of medication. They are ready for administration. 85. To calculate doses, what is the pediatric method for calculation based on infants younger than 2 years old? A. Clark's rule. B. A nomogram. C. Fried's rule. D. Young's rule. Correct answer, C. Fried's rule. Fried's rule is based on the age of the child, infant, in months and used when calculating doses in an infant less than 2 years old. Estimate the dose of medicine by multiplying the adult dose by the child's age in months and then divide the product by 150. 86. Before you prepare any medication to be administered to a patient, you should A. Ask the patient how he or she would like to receive the medication. B. Ask if the patient is allergic to any medication. C. Ascertain the patient's comfort level and ability to receive medication. D. Check the medication 3 times before administering it. Correct answer, B. Ask if the patient is allergic to any medication. Ask if the patient is allergic to any medication. Before you prepare the medication, the medical assistant must always ask the patient if he or she is allergic to any medications. If allergic to the specific drug or that drug category, alert the physician so that an order for an alternative medication can be ordered. 87. Your patient has been placed on 2 different medications. Your patient is not improving and the physician discovered that one drug decreased the effect of the other. What is this drug interaction called? A. Potentiation. B. Antagonism. C. Side effects. D. Pharmacokinetics. Correct answer, B. Antagonism. This interaction occurs when the effect of one drug decreases the effect of another. The possibility of an antagonism occurring makes it absolutely necessary to obtain a current and accurate list of medications. 88. The study of drug action as it moves in the body. Pharmacodynamics. B. Pharmacokinetics. C. Pharmacology. D. Cumulative effect. Correct answer, B. Pharmacokinetics. As drugs move through the body, the main action terms associated with this movement include absorption, distribution, metabolism and excretion. 89. Which of the following is a prophylactic drug? A. Corticosteroids. B. Compazine. C. Amoxicillin. D. Hepatitis B vaccine. Correct answer, D. hepatitis B vaccine. Prophylactic drugs help to prevent disease and certain conditions. When vaccines are administered, a number of diseases can be prevented. Some examples are human papillomavirus, tetanus, measles, mumps, rubella, and varicella. 90. Your patient is displaying signs and symptoms of chronic anxiety. Which type of drug might be appropriate? A. Diazepam. B. Ritalin. C. Testosterone. D. Amoxicillin. Correct answer: F. Diazepam. Anti-anxiety drugs produce central nervous system depression. Drugs such as diazepam, Valium, alprazolam, Xanax, and lorazepam, Ativan, are considered anti-anxiety drugs. 91. When we justify our thoughts or actions, whether it is right or wrong, rationalization. B. Sublimation. C. Feedback. D. Displacement. Correct answer: F. Rationalization. Rationalization is justifying thoughts and actions, whether it is right or wrong. It can also be used in making excuses. 92. According to Sigmund Freud, a child can be fixated at this psychosexual stage if he or she becomes obsessed with control, perfection, and cleanliness. A. Oral. B. Anal. C. Phallic. D. Latency. Correct answer: B. Anal. The anal stage is directly related to a child's awareness of bowel control and gaining pleasure through the act of eliminating or retaining feces. It is believed that when a child becomes fixated on receiving pleasure through controlling and eliminating feces, a child can become obsessed with control, perfection, and cleanliness. 93. Which of the following is not an effective communication strategy for the visually impaired? A. Alerting the patient before touching him. B. Increase your tone so he can understand you better. C. Describe surroundings and locations of structures. D. Allowing the patient to touch instruments and things when appropriate. Correct answer: B. Increase your tone so he can understand you better. In sight-impaired patients, you should speak in a normal tone of voice. Not all visually impaired are deaf. Describe the surroundings, alerting before touching the patient, and allowing the patient to touch his surroundings when appropriate are strategies to assist the visually impaired. 94. What legislation prohibits discrimination against people with disabilities in employment, transportation, public accommodation, communications, and governmental activities? A. CDC. B. OSHA. C. ADA. D. CLA. Correct answer: C. ADA. The American with Disabilities Act, ADA, prohibits discrimination against people with disabilities in employment, transportation, public accommodation, communications, and governmental activities. The ADA was passed by Congress in 1990. 95. In scheduling procedures, the chief complaint of the patient assists the medical assistant in the following, except identify the reason for the consult. B. Identify the urgency of the patient visit. C. Identify the diagnosis of the patient. D. Identify if the facility is equipped to handle the patient visit. Correct answer: C. Identify the diagnosis of the patient. The chief complaint does not identify the diagnosis. It is the main reason for the visit. It can assess the urgency of the visit and the capability of the facility to attend to the patient. 96. When medical supplies are being inventoried, the medical assistant should A. Have a list of all supplies and equipment. B. Organize the supplies in different storage containers with labels. C. Secure the supplies in cabinets or storage rooms. D. All of the above. E. Both A and C only. Correct answer: D. All of the above. The medical assistant should have a master list of all supplies and equipment. Supplies should be organized in specific containers with labels and all storage areas should be secured. 97. Screening calls is important because it allows the office to underscore A. Avoid patients who are not emergency. B. Triage patients according to priority. C. Avoid disruptions to the appointment schedule. D. Prevent walk-ins. Correct answer, B. Triage patients according to priority. Screening calls allows the health provider to prioritize or triage patients according to who needs care urgently from those who can wait. Emergency patients should be seen immediately and referred regardless of whether they have an appointment or not. 98. Which of the following is not a type of business formation for a medical practice? A. Partnership. B. Sole proprietorship. C. Corporation. D. Liability ownership. Correct answer, D. Liability ownership. Partnership, sole proprietorship and corporation are all examples of medical practice management. Liability ownership is not a medical practice management type. 99. SOAP chart refers to A. Subjective, objective, administer, proposal. B. Subject, opportunity, access, program. C. Subjective, objective, assessment, plan. D. Systems, operations, assessment, project. Correct answer, C. Subjective, objective, assessment, plan. SOAP chart is an acronym for Subjective, Objective, Assessment and Plan. It is also referred to as the Progress Notes chart. 100. If you have a new patient appointment, which of the following should not be asked from the patient? A. Social Security number. B. Birth date. C. Religion. D. Insurance information. Correct answer, C. Religion. When setting up a new patient, it is important to ask the following: name, age, address, date of birth, social security number and insurance policy. Religion is not a standard information asked by health providers. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.